Hi everyone, thanks for joining us today. My name is Brandy. I'm here at the Lake Almanor Clinic at Seneca Healthcare District. I'm joined today by Dr. Juan Martinez, our newest podiatrist to the Lake Almanor Clinic. Dr. Martinez is here to tell us a little bit about podiatry, but let's start with his background first. Dr. Martinez, where are you originally from?
So I am from the Bay Area originally. I grew up just south of San Francisco for a short time, but I call myself basically a Northern Californian and a Northern Nevada native. Most of my formative years were spent up in Reno, Nevada, so I'm very familiar with the area here and glad to be here.
Awesome. Well, we're glad to have you.
Thank you.
Let's get into it. Can you tell us a little bit about podiatry itself?
Sure. So podiatry is the treatment of all medical conditions, foot and ankle related. I can do anything basically from the toes all the way up to the knee. Now there are some caveats with that. I'm not an orthopedic surgeon, but I do orthopedic surgery, which sounds kind of funny. But any surgery related to the foot and ankle, I do. But patients don't always want surgery and treatment of their ailments, foot and ankle related. So I do a lot of dermatology, neurology, vascular work as well for foot and ankle related services.
Nice. Well, good to know. What inspired you to pursue a career in podiatry?
Well, I grew up playing sports. I had my fair share of foot and ankle injuries. Worked with podiatrists who helped get me back working, playing sports, and I thought it was a great field of medicine to go into. It's also a very good family life. I have a wife and 3 young kids, so it's been very good to me in that respect as well.
Absolutely. Good to know. What types of conditions or concerns do you most frequently treat?
Oh, there's so many. You know, I think there's a statistic out there that says 70% of people will have a foot or an ankle ailment at some point in their life. Wow. And that can relate to anything like a sprained ankle, heel pain from being on your feet too much, working, ingrown toenails. So those are the more, everyday kind of things I see. But I see people who come in with, structural deformities, bunions, hammer toes, fractures, injuries that do need surgery at times. So I do that as well too. So it really is a mixed bag, which makes podiatry really well also.
So how would you describe your approach to patient care?
It's a team approach. I always try to strive to tell my patients 3 things: what's going on, why it's going on, and what we can do to fix it. Okay? And I always tell them I have my part that I'm going to do to make sure I get you feeling as best as possible. But a lot of care, not just foot and ankle, but in medicine in general, really depends on how compliant or how committed a patient is to getting better also. Most of the time, you're not going to get better with whether it's, a foot fracture or an injury or going to physical therapy. It's not going to, get better overnight. There's certainly a lot of work that goes into it, and a lot of people or patients don't think about that, but I try to kind of stress that importance to kind of set the right expectations and have them understand what it takes. But once there's that mutual understanding, things go very well. Part of podiatry is after we're done with our 4 years of schooling, we take our residency, which is a 3-year surgery training where we get a lot of advanced technical training in surgery. Okay, and aside from those 3 years, between the years of 2020 to 2025, I worked in the Central Valley of California here, Fresno area. Very rural healthcare as well too, but I also for about 1.5 years worked in the LA area too, in the kind of the suburbs of it, very wealthy suburbs to be quite honest with you. So needless to say, I've seen my fair share of everything. There's nothing that's really going to surprise me or scare me or something that I haven't seen before. So I do find myself, or feel I'm very capable to take care of patients and all their foot and ankle needs here. There's a lot of things I do treat. Maybe I haven't mentioned everything that I've treated today in our interview here, but I certainly wouldn't want any of my patients or anyone potentially out there who has a question of, well, does he treat this or does he treat that? There's nothing that I won't see and consult on. Perhaps there's a few things that I don't have enough training to, but I would certainly refer that person to the right specialist in that case. But if anyone ever has a question, well, can I be seen for this or that foot and ankle related? Come on in. There's nothing wrong with that. I'd be happy to see you and give my consultation, and we can work together that way.
So for those of us wondering what might not be normal or what we might need to get podiatric care for, can you explain a little bit about that?
Yeah, there's always some kind of warning signs that your feet or ankles will tell you that there's something potentially wrong. Swelling is one of the most common things. Certainly, if we spend all day, sitting in the car driving on an airplane, yeah, we're going to be a little bit swollen. If we're on our feet all day, sure. But we're talking perhaps swelling under unusual circumstances, usually accompanied by redness, heat, achiness. Sometimes there's sores on the feet that we don't realize right away that can, go unnoticed. Tingling, burning, and numbness are also very important signs to watch out for, especially in diabetic people, because those can be warning signs that the diabetes may not be so well controlled and potential problems with your foot and ankle. Another thing you can look out for is abnormal wear patterns or tread patterns on your shoes. If you see that one side of your shoe seems to be wearing out a little bit more than the other, or if it's breaking down in a certain way and it consistently does that, no matter what kind of shoes you're wearing, that can be another sign that there could be an issue that may be addressed.
This has been very informative. Thank you so much for joining us, Dr. Martinez.
You're welcome.
If you would like to schedule an appointment with Dr. Martinez, you can call the Lake Almanor Clinic at 1-833-227-3743. You can visit us at 199 Reynolds Road in Chester, California. You can go on our website and schedule an appointment via email. Thank you.
Thank you.